In this video by DeckPlate we will understand the hip and thigh rating for VA compensation. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Decoding VA compensation ratings. Are you struggling with hip or thigh disabilities and seeking compensation from the VA? Understanding the intricacies of the VA compensation system can be daunting, but fear not. In this video, we'll break down the VA compensation ratings for hip and thigh disabilities, providing clarity on diagnostic codes. Hip ankylosis, diagnostic code 5250. Hip ankylosis refers to the fusion or immobility of the hip joint, often resulting from injury, disease, or surgical procedures. The severity of hip ankylosis greatly impacts an individual's mobility and quality of life. Unfavorable ankylosis, rating 90%. When hip ankylosis is extremely unfavorable, rendering the foot unable to reach the ground without the aid of crutches, the VA compensates at a rate of 90%. Intermediate, rating 70%. If hip ankylosis is less severe but still significantly limits mobility, the VA provides a compensation rating of 70%. Favorable ankylosis, rating 60%. In cases where the hip joint is fused in flexion at an angle between 20 degrees and 40 degrees, with slight adduction or abduction, the compensation rating is 60%. Thigh limitations, diagnostic codes 5251, 5252, 5253. Thigh disabilities encompass limitations in extension, flexion, and impairment of abduction, adduction, and rotation. These limitations can arise from various conditions such as injury, muscle weakness, or neurological disorders. Thigh extension limitation, diagnostic code 5251. Extension limited to 5 degrees, rating 10%. Thigh flexion limitation, diagnostic code 5252. Flexion limited to 10 degrees is rated at 40%. Flexion limited to 20 degrees is rates at 30%. Flexion limited to 30 degrees is rated at 20%. Flexion limited to 45 degrees is rated at 10%. Thigh impairment, diagnostic code 5253. Limitation of abduction is rated at 20%. Limitation of adduction is rated at 10%. Limitation of rotation is rated at 10%. Hip flail joint, diagnostic code 5254. A hip flail joint occurs when there is significant instability and dislocation of the hip joint, often causing severe pain and limited mobility. Hip flail joint, rating 80%. The VA provides a compensation rating of 80% for individuals with a diagnosed hip flail joint. Femur impairment, diagnostic code 5255. In addition to hip and thigh disabilities, the VA compensation system also considers impairments related to the femur, the longest bone in the human body. Fracture of shaft or anatomical neck of femur. With nonunion, with loose motion, spiral or oblique fracture, rating 80%. With nonunion, without loose motion, weight bearing preserved with aid of brace, rating 60%. Fracture of surgical neck of femur, with false joint, rating 60%. When a fracture occurs in the surgical neck of the femur resulting in a false joint, the compensation rating is 60%. Understanding these VA compensation ratings is crucial for veterans navigating the disability claims process. If you or someone you know is dealing with hip or thigh disabilities, it's essential to gather medical documentation and seek assistance from VA-accredited representatives or legal professionals to ensure you receive the compensation you deserve. By decoding the VA compensation ratings for hip and thigh disabilities, veterans can better advocate for themselves and access the support they need to improve their quality of life. Thank you for watching this video. Please don't forget to subscribe and like our videos.